On a recent shift, a patient told me, "I've had chest pain for a week, and the last doctor that saw me didn't do shit for me." So let's talk about why this happens in the ER. A common frustration that patients often have is leaving the ER without a clear explanation of what caused their symptoms in the first place. And here's the truth. The ER is built for acute problems, not long-standing issues. So if you've had back pain for 8 months with no new or worsening symptoms, that's actually reassuring because it means that it's not life or limb threatening. Chronic problems need long-term strategies, medications, and follow-up. And that's the role of a family doctor, outpatient clinic, or a specialist. Now, things like chest pain are a different story because there's so many lethal conditions that can manifest as chest pain. And because of this, in the ER, we often practice what we call rule-out medicine, where we'll use labs, imaging, and risk calculators to exclude serious things like a heart attack, collapsed lung, blood clot to your lungs, aortic tear, and inflammation around your heart. Sometimes after all the tests are done, we can't give you an exact answer what's causing your symptoms, but we can provide reassurance that it's nothing serious or life-threatening. We can give you instructions on how to alleviate your symptoms and a clear follow-up plan moving forward. And that was the case with my patient. My colleague had done all the right tests and had documented that they thought it was most likely due to muscular chest wall pain. So the problem wasn't the medicine, it was the communication, because the patient left without any reassurance, and that's why they bounce back. And I know it can be unsatisfying to not have answers. It's frustrating for both the patient and the doctor. But sometimes the most important part is if we've ruled out all the dangerous things, you can at least leave the ER with peace of mind, knowing that it's safe to follow up outside of the ER.